Thank you very much, Jay. Indeed, it is my pleasure to be able to have a chance to talk with you all today about this very important topic. And don't worry, for those of you that are coming to part two, we are not going to repeat all of those slides at all. But I understand that we might have a few people that are brand new. And so I'm going to begin with a particular slide. And most of all, I want to hear from you. I hope you'll answer the questions in the chat box. I hope you will also provide some questions for us. So the suicide of a student is a very challenging time for schools. And the wisest decisions in education are always made by a team of people, and school mental health professionals, administrators, school resource officers are particularly important in terms of making those wise decisions about how to move forward. And there's actually been a toolkit out there. I helped develop it in 2011. It was revised in 2018. With actually very minimal changes. It's one of the many excellent resources available from the Nebraska Department of Education at that particular link. And a couple of things that I really want to highlight that are on that website: help for parents dealing with suicidal concerns. And it is very important that we also pay attention to reentry when a student has been hospitalized and has missed school due to suicidal concerns. There's a checklist for schools for developing reentry, and there's tips for reentry for school staff. And Nebraska has done extensive training on the suicide behavioral questionnaire that is revised. And sometimes after there's been a suicide, school mental health professionals are really alarmed because all of a sudden there's more kids talking about suicide, being referred to school counselors, school psychologists, and social workers. Frankly, those students are out there all the time. But now, thankfully, they're being referred. And so there is a chance to work with them and do that screening. And I might have given the example where I used to work in Texas. I did work full-time as a school psychologist for 26 years. For 24 of those, I directed psychological services for the third largest district in Texas. All I can tell you is a lot happened there. I was their go-to guy after every crisis, whether I was really up to it or not. But we lost 42 students to suicide during that time. I think I was the only one that kept track. And I'm not counting a kid who dropped out or a kid who went to another suburban school district in Houston. I'm just talking about a kid that was supposed to show up at our school, and unfortunately, they died the day before. But what's really the obvious question out of those 42 deaths? How many of them did we actually get a chance to work with, to screen for suicide, to notify their parents, to work with community-based professionals that we referred to and share information and develop any kind of a safety plan? The answer was only 2. The other 40, we'd never heard of. We had no idea they were suicidal. Now, every single time, we realized that their friends did know something about their suicidal thoughts and behavior. So that's to kind of bring anybody up to speed who's tuning in for the first time today. But we're going to continue going through some examples, and I have a lot of them. I've been at this now for 42 years, and I heard from yet another international school in Brazil just in the last week that sadly experienced the suicide of a student. And I promise you that I do return phone calls. I do respond to emails. I'm happy to provide free consultation to any school that's struggling with the aftermath of a suicide. I wish I could tell you we had a lot of research about postvention. And that word was actually coined by Schneidman, talking about a series of planned activities in the aftermath of a dire event. And what really is the goal of postvention? And it's come to mean pretty much only after a suicide. You certainly do things to help all concerned. If a kid dies in an accident or a kid died of leukemia, for example, but postvention is really quite specific to activities to help everyone in the aftermath of a suicide, help them with their grief, their shock, their confusion, and yes, sometimes even the guilt that they're experiencing. And we're going to talk in a few minutes about who might be most at risk now that the suicide actually happened. So the little research we have says our postvention efforts have been too short in duration and they focus on too few students. So we need to cast a much broader net and trying to figure out who might really be affected by the suicide of a young person in this school and community. And then you see a rather sad statistic that losing a classmate to suicide may affect you for years. Heck, we talked about postvention in my doctoral clinical class yesterday, and several students sitting there, and they're all in their early 20s. Several of them lost classmates in middle school or high schools to suicide, and it still bothers them. And I'm a big fan of the Jason Foundation. I do a lot of training for the Jason Foundation. And of course, it's in memory of Jason, who was a high school kid in Tennessee who died by suicide. But his dad shared with me that one of Jason's friends stopped by to see Mr. Flatt not long ago. And even though it has been 25 years since his friend lost Jason to suicide, it still bothers him. There are also autopsy and CDC epidemiology studies, and I think I actually said that word correctly, epidemiology, also called epi studies. I personally believe we need a lot more of those. If you were to go to the CDC website and start researching suicide contagion and cluster, you're going to find a lot of outdated research, some of it going back into the late 80s. We need a lot more study. And the autopsy studies and the American Association of Suicidology often wants to do autopsy studies in the aftermath of youth suicides, but too often the family doesn't cooperate. So we don't necessarily learn all the lessons that we would like. You've already glanced at. So what little do we know? Access to lethal weapons, substance abuse, academic pressure, GLBTQ issues as contributing factors, and parents who sadly just didn't see the need for mental health treatment for their child. But certainly more research is needed. So I believe we have to approach every situation with the strong belief that we can prevent a youth suicide. But going to 17 communities experiencing suicide contagion in a cluster, I'm going to say something like what's on this slide. Sadly, we could not prevent those suicides, but the focus is on the future. The focus is on the living, and we need to work harder to prevent future youth suicides in this school and the community. So I hope somebody will put something in the chat box and Kim or Sally will give us the answer to this. I'm going to argue the impact of a youth suicide is greater than ever before in 2024. But why? Why is that? I'm going to argue it's like taking a rock and throwing it into a pond. That ripple effect is everywhere. But we'll stop in just a moment and see if anybody has indicated why. Why do I believe that impact is greater than ever before? And we need to make sure that our schools and our communities don't underestimate the impact of a youth suicide. And Sally or Kim, do we have any answer in the chat box as yet?
Yes, they are overwhelmingly talking about the impact of social media, the fact that it can be really broadcast so quickly and so powerfully.
Absolutely. And doing a lot of crisis work for 4+ decades, some years ago, we could all be in the principal's office and we could be working out a plan, and we could say, we're going to have a plan in place by tomorrow morning about what we're going to do. But with social media and with texting, we don't have until tomorrow morning. We need to develop a pretty quick plan right now. I'm about to give my school psych and my clinical students a midterm. And sometimes they're like, oh, well, how about a take-home midterm? And I go, well, if a tragedy, a crisis has happened, I don't think the principal is going to come to you and say, hey, you got 2 or 3 hours, research something and give me some ideas. They're going to be like, I need some guidance right now. And so that's why I don't give them open books or some kind of take-home exam. There's certain things in my crisis class that I hope they just know them immediately and could advise an administrator very quickly. It's really important that you see this slide. I know I referenced the points that are up there. The answers died with them. Too often, everybody is trying to figure it out. That's taking us backwards. And I use this statement. You might know, or you might think you know quite a lot about things that were going on in this young person's life. But don't make a sweeping conclusion based on what you know or you think you know about one youth suicide. We have thousands of them every single year. So if you want to make a conclusion, let's make it based on what the literature says is happening over and over. So we're always trying to put the focus on the living. You're here, you lost a close friend, you lost a classmate, you lost a member of your school community. So the focus is on the living. The answers are lost with the suicide victim. And in our first webinar, I was very careful in my choice of words. And I should mention, if anybody is new, that I'm a survivor of my father's suicide. I was 25 when he shot himself. I'm a good example of somebody who didn't know what to look for, didn't know what to do, never thought it could happen in my family. So if you're a survivor and you lost a loved one to suicide, I have a pretty good idea of what you've gone through. But I believe strongly in prevention. I always use the term died by suicide. One of you were to tell me my dad committed something, I'm going to say you commit a crime, you commit a burglary. Died by seems to imply they traveled a long road. And even a 12-year-old kid traveled a long road. We could argue it's everyone's fault, yet it's no one's fault. And we should never be trying to place blame or to give a simple explanation. And yesterday in class, I shared one of the worst newspaper headlines I've ever seen. It was from Springfield, Missouri. Picture of a very attractive teenage girl on the front page. The headline was, "Popular Ozark Student Falls to Dark and Lonely Thoughts." It described how she picked up her black dress at the cleaners. She put it on, of course. She drove to the Holodome in Springfield, Missouri. She dropped her cyanide tablet in her Coke, drank it, and fell dead to the floor. Then the article said she was just too sensitive for this tough world. We never want to give any kid the message they're too sensitive for this tough world. But can you see all the things that were wrong in that particular article? First of all, the picture, a headline that was "Popular Ozark Student Falls to Dark and Lonely Thoughts." So kind of a simplistic, almost a mystic explanation, gave the details of her suicide method, and even referred to her as just not able to move forward in this difficult world. Save.org, Suicide Awareness Voices in Education, has reporting guidelines. There's another website, and you'll see these when I get to the slide, reportingonsuicide.org. Perhaps my favorite example, the reporter came out, wanted to do a story on the suicides where I used to work, and I convinced him, don't do your story today. Come back in a couple of weeks. Let's do a story on prevention. Let's do a story about somebody who got the help they needed, somebody who sought out adult help, or a friend who came forward and got help for their friend or classmate. And it reminds me of being in a high school classroom where I used to work, and all the desks are in the circle, and I'm talking to them about suicide prevention and their important role. And one of the students raised her hand and said, I did exactly what you said. Last year in 8th grade, I went in and told the school counselor my friend was suicidal. He made me feel like I was some kind of a snitch. So the kid did the right thing, but the school counselor dropped the ball. The school counselor should have been saying, thank you. You did the responsible thing. It's possible that your friend will be angry at you for a while, but absolutely, this is what a good person does. So, I might be the oldest person on this webinar, but if I started talking to one of my elderly neighbors and they started talking to me about hopelessness, giving up, and thoughts of suicide, I would get help for them. And you would all say, absolutely, that's what we need to do. And I think this is a critical component. And seeing Jay and knowing the focus of school safety, I believe strongly that most school shootings should have been prevented. Most youth suicides should have been prevented. Every kid needs a go-to trusted adult, and they need to know what are the things that we can't hesitate. Somebody's talking homicide or suicide. We need to get them help. All right, so I've been on this slide for quite a while. Postvention is suicide prevention. That's really a key thing. We're trying to prevent the next suicide. We're trying to help everybody with all those emotions that they have. But who do you think should be involved in a community in the aftermath of a suicide? So hopefully you'll put some of those ideas in the chat box, and we'll look at that in just a moment. I was talking about media coverage. So Broward County, 265,000 students, okay? From Palm Beach to Miami, which is, let's say it's 50 miles. I don't know, there's 3 million people. So the suicide of a young person in South Florida, it's not news, okay? The suicide of a young person in McCook, Nebraska is news. So I think it's especially important that in our small town, like the one I was raised in Kansas, that we make sure that media know the reporting on suicide guidelines. So do we have any comments, Sally or Kim, about who needs to be involved?
They're saying everybody in the community, schools, churches, law enforcement, medical personnel, parents.
All right, it takes a village. So yes, school leaders, civic leaders, clergy, local mental health, law enforcement, survivor groups, and medical professionals. Last time, I know I shared that the majority of suicide victims actually saw the family physician shortly before they ended their life. So if you would ask me, what's my frustration of 40 years of working on youth suicide prevention? I just decided a long time ago, I tell people exactly what I think. Two groups that are a little difficult to get to the table on this subject: school administrators, and I gave examples of that last time. The other would be the medical community. And I remember going to Fairfax County, Virginia after a suicide cluster at one high school, and there were hundreds of people in the village there for me to talk to. But I asked the obvious question: do we have any physicians here today? out of the 200 people that have come together to do something to prevent youth suicide? The answer was no, not a single one. A few years ago, I was the keynote at the Texas Suicide Prevention Summit. There were 1,000 people or more in the audience. So I asked, if we have any physicians, would you please stand up and let me recognize you and especially thank you for being here? Not a single person. So I've often argued, how do we take it to wherever the doctor's office building is? Let's have our meeting in the local hospital, whatever we have to do to get physicians involved. I remember going to Rapid City, South Dakota after yet another suicide cluster. And they only really had one psychiatric hospital. And the superintendent was like, I'm going to get a meeting with the chairman of the local hospital to try to convince them that their staff has to lobby parents to share information with us. So I complimented Nebraska on having those reentry plans. But too often, the kid was hospitalized for being suicidal, and they just walk right back into class. And we really need a reentry meeting, try to figure out how can we smooth that transition. You ever had a mom or a dad say, oh, she missed 5 days of school because she had mono. Meanwhile, her best friend is saying, oh no, they hospitalized her because she attempted suicide. So school personnel, school mental health professionals need to know so they can reach out and be a part of that important reentry planning. So you're all pretty aware of this. Social proximity for adolescents is progressively transcending physical geography. Vulnerable young people find each other online. And when something tragic happens, it impacts large groups of students, much broader than an individual school. St. Louis High School principal called me for help, and he was saying she was on the school soccer team. It's going to be really difficult for the school soccer team. Wait a minute, she played on a travel team. There were kids from 9 other St. Louis high schools on that elite travel soccer team. So those on the webinar today can help those that are not understand the impact of this is probably much greater than you are initially thinking. Okay, so let's imagine the suicide of a 14-year-old freshman female just happened. Who is now most at risk after suicide? And, you know, we know that females attempt suicide 4 times more often than males. We know males die by suicide 3 or 4 times more often. So I'm remembering one example. Actually, it was a 14-year-old girl. She shot herself with Dad's pistol. Dad was a policeman. Dad, when he came home from his work in law enforcement, always put his pistol on top of the dresser. He said, I always taught my children never touch my gun. Well, unfortunately, she touched that gun, pointed at her person, pulled the trigger, and she pleaded with her parents not to let her die. She died. And I'll never forget going to MYF and having her classmates in MYF say, what choice did she have? She told all of us at Methodist Youth Fellowship she was going to kill herself. She had to follow through and do it. That maybe illustrates the incredible challenge that we have. And I remember following her schedule. I remember meeting with her closest friends. I remember meeting with her surviving sister. I remember going to her house and meeting with her parents and taking one of my interns with me. And that evening, I remember taking the intern back to where we had left her car. Her name was Mary, and Mary said, Scott, I feel so guilty about something. Why is that, Mary? She said, I learned so much about postvention today, but a kid had to die. for me to learn all this. And that night, I was actually presenting to my school board. You see, I wanted adventure-based counseling. I wanted to build ropes courses, low elements to work on problem solving and communication, high elements to work on trust and self-esteem. So how did I open my presentation to the Cypress Fairbanks School Board? I'd like to tell you how I spent my day today. It was all about postvention, meeting family and friends, all working one day too late. And I couldn't help but think all day long, if we had more programs that actually taught kids problem-solving skills, taught the importance of seeking the help of others and trusting in others and raised their self-esteem, just maybe we wouldn't have had yet another youth suicide. I mean, I got a 7-0 vote for the ropes course. Superintendent took me aside and said, "Great job, good presentation. Now, you know, they didn't give you any money." I looked at him like, "You're kidding me. They didn't give any money?" No, you're gonna have to raise the money if you want this program. With the help of some other people and a lot of fundraising. Although I never really saw myself as a fundraiser, but I raised $750,000. We built 3 ropes courses. We built 3 support buildings. That's really where the bulk of the money went. Have to store equipment, got to have restrooms, has to be accessible to the disabled, have to be able to get kids under shelter if there's a storm. I ran that program for 14 years. And maybe what's the point I'm trying to make here? Some of the things we're doing are really great with young people. Some things we're doing aren't reaching everyone. And I think we have to be open to think about how can we be able to have more innovative things. What I'm describing, probably some of your kids did it at summer camp, but you're an underprivileged kid, you're in a city, you're probably not going away to some exciting sleepaway camp. So you're not able to do zip lines and to work on some of the lower elements that really involve the group coming up with a plan. How can everybody get safely under, over, through whatever the obstacle is? So clearly, I'm a big fan of adventure-based counseling, and I use many of those activities in my classes currently. But back to Sally and Kim. Who's the most at risk after a suicide?
So they definitely are talking about siblings, close friends, those with mental health issues, but also resounding in this conversation is to not focus only on those students, that anybody could be at risk. And that's coming up in these discussions as well. Just be really careful about not just narrowing the scope and be willing to look at anybody as potentially at risk.
Great responses. The literature is actually saying very often it's the less close friends that are more at risk. And they're at risk because of their own sad set of adverse childhood experiences. Now that it actually happened, it's like barriers and inhibitions are down, and they're looking at the method that person might have used, or they're thinking, I have all those problems that she had, even more. But what CDC say? Backed out of a suicide pact. One of my legal cases that I can't really go into in great detail because of time, but there was a pact and the counselor knew about the pact. And one kid was in the hospital because he attempted yesterday. The other kid who's supposed to be in the pact has written a suicide note. And the counselor met with him. He denied being suicidal. And so the counselor took no further action, did not contact caregivers. The kid went home, had an argument about his grades, broke into a trailer in rural Washington state, and he shot himself. It's like, pacts do happen. We need to pay attention. And if you suspect a kid is suicidal, no matter how low you think that risk is, you need to contact their parents. He was in the counselor's office because he suspected the kid was suicidal. Denial is very common because at some level they have to realize I'm not walking out of this office anytime soon. I actually have one of my work study students researching how often is it that the suicide victim denied being suicidal. I think it's actually a pretty high percentage of the time. Last negative interaction. 4 kids on a Monday morning told me, we told Sarah Saturday night was the night she was supposed to die. We knew she had her dad's gun. We told her where to put the gun, pull the trigger, it would be quick. Those kids are going to remember that for the rest of their lives. I mean, it's incredibly appalling to think kids would actually encourage somebody to die by suicide. But unfortunately, it does happen. And then there are other kids. They're like, okay, the way she told me goodbye the other day, I should have known something. That note she left, she gave me her favorite necklace, the one she had inherited from her beloved grandma. I should have known. Right? So we always have these if only thoughts. And sometimes they're rational, sometimes they're very irrational. I had a kid in a small town in Texas. I've got all the deaths in a circle. And I said this last time, but I'll repeat it. We got to talk to kids more about suicide prevention. Absolutely. We need to do it in a group size no larger than a classroom. So they will ask you questions and you'll get a read on how they're experiencing this. So the kid says to me, I should have called her last night. If I'd have called her last night, she'd still be alive. Did you call her often? No. I'd never called her. Did you have her phone number? No, but I should have had it. I should have called her. So that's pretty irrational. But he still had those if only thoughts. We had a school shooting in the cafeteria where I used to work. And you know what? A lot of his staff and students said, by the way, the assistant principal was shot. He recovered, thankfully, but he'll walk with a cane for the rest of his life. So staff and students are like, why did I dive under the table? Why did I run out the door? Why didn't I do something to heroically stop the 15-year-old from shooting a couple of people? Or even staff that knew the kid well, they're like, why didn't we somehow see that coming? I remember leading a team after a school shooting in Kentucky, and it was a high school kid that shot people. Elementary teachers were like, he was here for 5 years. We should have somehow known something, done something different. Everybody has these if only thoughts. And for me personally, of course, I wish I'd have just known enough to say directly to my dad, are you thinking of killing yourself? Is that what this is about? I'm pretty sure he would have said yes. And then I would have had a chance to actually do something. So, and the last category. So I can look out the window and I can see Nova Public High School. It's large by Nebraska standards. And for simple math, I'm going to say 2,500 students. Based on the most recent Youth Risk Behavior Surveillance Survey data from 2021, we would predict 10% of the kids that walked into that building today made a suicide attempt in the last 12 months. In my example, that's 250 kids. You know what's really scary? For the most part, I'm going to argue their parents don't know. The school counselors don't know. The administrators don't know. But who would know all about their previous suicide attempts? That would be their friends. And so when it happens, I get a call like this. I am the 9th grade counselor. And you know, we had an 11th grader die by suicide. I've been working with 8 9th graders this year. All of them have been somewhat suicidal. Do I need to see them all today? Can you see how easy that question is to answer? Absolutely, you need to see them today. It actually happened in your school community. Sometimes I like to joke, I spent a career giving somebody an answer. You have to know what I'm going to say. You knew I was going to say yes. See every one of those kids as quickly as possible. Check in with their parents. Find out if they're in treatment. See if they still have a copy of their safety plan. Let's take a picture of it. Let's put it on their phone. Okay? So we've touched on this topic of safe messaging. This is also what you would find at save.org for suicide awareness, voices, and education. And unsafe messaging can lead to contagion. I already talked about the preferred term, died by suicide. You know, we have a massive psychology department here. I don't know, 50 full-time professors. I wish I could tell you none of them ever put the word committed with our topic today, but they do. We need major training. And here's the other bottom line. Everybody would expect a licensed psychologist, a licensed family therapist, a licensed social worker, a licensed counselor. The layperson would expect every one of those professionals to know suicide risk assessment and management. It's not a required competency for any of those groups. So what's that mean if you're referring for community-based treatment? You got to refer to people that actually are skilled, not just in working with adolescents, but they know suicide risk assessment and management. Here's an example from Nebraska. A dad says to me, you know, I did exactly what the school said. I took my kid to see the psychologist they told me to go see. He told me my kid was a typical teenager. And 2 weeks later, my kid was dead. So we need to seek it out. And it is not a competency. APA has all these competencies for clinical psychology. Suicide risk assessment is not one of them. Maybe somebody will put in the chat box, does Nebraska require any training on this area for continuing education to keep your license? So I've been licensed in Texas for 41 years. I've never had to take one single hour on suicide risk assessment and management. So the challenge is making sure people are well trained. Okay? There are evidence-based treatments for all forms of mental illness. There's that statement about making sweeping conclusions based on what you think you know about 1 or 2 suicide deaths. Resiliency and recovery are very possible. Resiliency is the big word in Florida. I want to keep politics out of this, and resiliency is important. So what are the keys to resiliency? Being surrounded by loving and caring family and friends, having the opportunity to vent strong emotions, having problem-solving skills, being optimistic about the future. Resiliency is bouncing back, and it's largely a learned behavior. No one person, no one thing is ever the cause of a suicide. Joyner, who is a brilliant guy, he really talks about they've traveled a long road. This is a long psychological process. And for suicide to happen, it's been said that a lot of things have to go wrong at one time. And I believe that is definitely true. They've thought about it for a long time. There's often a precipitating event. Most common ones, severe argument with the parent, breakup of relationship, severe humiliation, maybe a discipline problem. And too often, if there's an unsecured firearm in the home, somebody who's thought about suicide for a while, something happens today, and if that gun is available in a few minutes, there can be a suicide attempt. And about 97% of the time, you attempt with the gun, you do not survive. Suicide postvention in the schools is very challenging. It takes an entire village. We need best practices responses. And a question, of course, has the school district ever been sued for failing to put in place a best practice response after the suicide of a student? the answer is yes. And we're going to talk about that in just a moment. We need 988. We need that in our hallways, in our classrooms. We need to be promoting the crisis text line as well. And we've got to be prepared to respond to the suicide of a staff member or a parent as well. And if you were on last week, I'm a big believer in we need to tell the truth. And we can only know the truth by making personal contact with the family of the victim and explaining we're never going to theorize why this suicide happens. We just need to focus on how can we increase suicide prevention. And if we can at least use the word suicide, then we can actually focus on prevention. We're trying to go forward, and we want to help your child's friends. We want to prevent further suicides. And hopefully you'll give us permission to actually acknowledge the cause of death. And I've had really great luck. But this is only in person, going to the home, talking to the parents. And almost always they're like, Dr. Poland, she had a surviving sibling, 1 year younger, same school. And I provided a lot of support. Her name was Shelley. I referred Shelley to get more extensive treatment than I could provide as an itinerant psychologist working in the schools. But I remember Shelley saying something to me. She said, my dad, he's a businessman. He just doesn't come home much in the evenings. He just stays in his office working. He comes home late and just goes to bed. And my mom, when I get home from school, my sister Christy had a beautiful voice. So my mom has all these recordings of Christy singing. So when I come in, my mom is usually in a dark room listening to Christy's music. I feel like I'm walking on eggshells. I don't even know whether to bring her up or not. That's a family that needs a lot of help. And suicide survivor support groups can be a great source of help. And I've been in touch with one family that they lost their son, an adolescent, to suicide 5 years ago. And I happened to be speaking in Oregon, which is where they're from, and they came to my session. My wife and I went to dinner with them, and they shared something with me that I'll never forget. They said, you know, it's been 5 years since Sean's suicide, and we haven't slept in our bed a single time in 5 years. We just sit on the couch, listening and watching television, praying that we might survive and get a few hours of sleep. These families need a lot of help. Can you imagine 5 years and they're still having sleeping problems? All right, moving on. There's that toolkit, 2011, 2018. I'm going to argue the best 50 pages ever written. In 2011, there was actually money for hard copies. In 2018, there were no funds for hard copies. So what would I suggest you do? And remember, it's on the Nebraska website. Print it out, make a copy. Maybe discuss it with the school crisis team so you're not madly looking for it and trying to figure out what it says in the immediate aftermath of a suicide. It's an excellent guide.